In medicine, a surgeon is a doctor who performs operations. Surgeons may be physicians, podiatrists, dentists, or veterinarians. History. In history, surgery was mostly associated with barber surgeons who also used the hair-cutting tools to undertake surgical procedures, often at the battlefield and also for the royal paymasters. With advances in medicine and physiology, the professions of barbers and surgeons diverged. By the 19th century, barber surgeons had virtually disappeared, and surgeons were almost invariably qualified doctors who had specialized in surgery. Surgeon continued, however, to be used as the title for military medical officers until the end of the 19th century, and the title of Surgeon General continues to exist for both senior military medical officers and senior government public health officers. Titles in the Commonwealth. In 1950, the Royal College of Surgeons of England in London began to offer surgeons a formal status for RCS membership. The title Mr. became a badge of honor, and today, in many Commonwealth countries, a qualified doctor who, after at least 4 years training, obtains a surgical qualification is given the honor of being allowed to revert to calling themselves Mr., Miss, Mrs. and Ms. in the course of the professional practice. But this time the meaning is different. It is sometimes assumed that the change of title implies consultant status, but the length of postgraduate medical training outside North America is such that a qualified surgeon may be years away from obtaining such a post. Many doctors used to obtain these qualifications in the senior house officer grade, and remain in the grade when they began subspecialty training. The distinction of Mr. is also used by surgeons in the Republic of Ireland, Australia, Barbados, New Zealand, South Africa, Zimbabwe, and some other Commonwealth countries. Military titles. In many English-speaking countries, the military title of surgeon is applied to any medical practitioner. Due to the historical evolution of the term, specialties, some physicians who are general practitioners or specialists in family medicine or emergency medicine may perform limited ranges of minor, common, or emergency surgery. Anesthesia often accompanies surgery, and anesthesiologists and nurse anesthetists may oversee this aspect of surgery. Surgeons, assistant surgical nurses, surgical technologists and operating department practitioners are trained professionals who support surgeons. In the United States, the Department of Labor description of a surgeon is a physician who treats diseases, injuries, and deformities by invasive, minimally invasive, or non-invasive surgical methods, such as using instruments, appliances, or by manual manipulation. Pioneer surgeons: Sushruta, Abu al-Kashim al-Zahrawi, Charles Kellman, William Stewart Halstead, Alfred Blalock, C. Walton Lillihay, Christiane Barnard, Victor Chang, Australian pioneer of heart transplantation, John Hunter, Sir Victor Horsley, Lars Lexell, Joseph Lister, Harvey Cushing, Paul Tessier, Golem Payman, Ioannis Palakaris, Nikolai Pyrogov, Valery Shumakov, Sviatoslav Fyodorov, Gazi Yasargal, Rene Favaloro, Michael R. Harrison, Michael DeBakey, Fidel Pages. Organizations and fellowships: ACFAS, FACS, FRACDS, FRACS, FRCS, FCPODS, FRCS, FRCS, FRCSI, MRCS,